Karen, and I thought I would come and give you an update on Watson's health, because I know not all of you will follow me on Instagram or Facebook. That is where I put updates and I put all the details of what's going on with his health. So if you're on either Instagram or Facebook, it's Watson the Warrior, and I always update there more regularly than YouTube. And I thought I'd tell you about our visit to the so-called Scottish super vet, who was just amazing. So we prepared for the visit as if he was going to have cruciate ligament surgery, because, you know, the local vet had kind of agreed that it could be that. It seemed to fit all of the symptoms, etc. And the other thing was, if it was a possibility to have surgery, it was going to happen on the day of the consultation. They tell you that. And so you almost have to prepare for that, you know. So I had made that folder that I showed you and all the preparations. We sold the car to get the cash together, because we were also told you will need to pay up front about £4,000 or £5,000 if it is this surgery. I'd got him a buggy, you know, I'd done quite a few things. But I already knew that, you know, if he doesn't need the surgery, it's fine. As it turns out, we like the new car more. Yes, we've got a bit of monthly debt now, but we've also got that savings for Watson, which we've put in a Watson saving account, because he's always got something wrong. He's got a lot of health challenges, and so at least we don't need to worry about that for the rest of the year, you know. And with the buggy, I knew I could return it because I got it from Amazon. I am going to do a video on the best dog buggies for dogs, because I got two, and they're the main two types of buggy you can use, and there's some big differences between them. So I'm going to do a video on that. So we went to the appointment. We arrived. Our appointment was at 10 o'clock. We got there and it's very, very clinical. It says not allowed to use mobile phones. I don't know why, but you're not allowed to get your phones out. We already knew they were very strict and very clinical, because, you know, they'd said don't take your dog for a run on the beach before you go in, because they have to be very clean in case they're having an operation. There's much less chance of them getting infection, and, you know, the x-rays are better, etc. So we had done all of that. We got seen on time. You know, it was very, very efficient, and the guy was lovely. John, his name is, and he was just amazing. And it's in a place called East Neuk, which I'd never been to. It was clearly in the middle of nowhere. But I'd already felt good about seeing this guy, because a lot of people had emailed me saying that they had been to see him and he treated their dog amazingly, and that he was worth the wait, and, you know, all of that kind of thing. It's really hard to get to see him. So we went in, and he just said he wanted to start from a clean slate. He said, I'm going to ignore everything the vet sent me, and I just want to start at the basics. And so he asked us everything about Watson, including what he ate, and he was very complimentary about Watson's body condition, his muscles, his coat. He said he's in very good condition. So that was really nice to hear. And then he asked to examine Watson, and he did so kind of on the floor. Watson always tries to get up onto the table, because he knows that happens, and then generally he'll get a treat afterwards. So he was a bit anxious, because we were in a new place, but he clearly knew it was some kind of vet. He's all right with his local vet, but anywhere else, like the cancer centre we go to, he absolutely hates. So he seemed pretty anxious, but the guy was doing all sorts of tests on him. He was like doing like a wheelbarrow, you know, lifting his back legs up and pulling them back. And he said, I can't properly examine him. He said, because he's quite tense. And he said, but we can do that under sedation. But he started off by talking to us about this thing called dyskinesis. So Watson does this little hop skip, which we assumed was related to some injury. But he said, I think that the little hop skip thing he does, and I'd sent the guy a video, and he'd watched the video and he referenced the video. He said, I think it's this thing called dyskinesis. And he said, it's normally little Jack Russell Terriers that get it, but it does happen in Doodles. And he had seen Doodles with it. And he knew the breeder of Watson and whatnot. So he'd worked with her dogs before. And he said, it has been seen in Doodles. And it's basically the brain doesn't signal correctly to the leg. And so they do this funny hop skip thing. And he said, regarding the dyskinesis, he said, it's nothing to worry about. It's not painful. Enjoy your dog and ignore it. Basically, he said, it's not a big deal. But he said, regarding why he's limping, he said, on my examination, there's nothing obvious. It could be a cruciate ligament. He said, but I don't think it's that, because he's all right after exercise, because Watson will go for 3 hours walking and be okay at the end of the day. The limp appears just out of nowhere. It can be in the middle of a walk. It can be in the morning before a walk. It just appears out of nowhere. So he said, what we're going to do is we're going to x-ray his back, his ankles, his knees and his hips. And then he said, you go away for a couple of hours, come back again and I'll give you the results. So that was our 10 o'clock, and it was the half an hour that we knew we were going to have with him. So 10:30, he took Watson away and told us to come back at 12:30. Both Kev and I were choked with a cold at this point as well, so not feeling the greatest. We didn't really feel like going off doing shopping or anything, but we needed to kill 2 hours. So we then realised we really were in the middle of nowhere, because we asked the receptionist where we could go, and she said, there's a little cafe down there, or she said, there's this great home store, and she was saying it sells candles and all of this, and the way she described it, I thought it was a department store. But when we went to, I don't know whether it was Largo, I think it might have been called, but anyway, wherever it was, we went to this store. It was like a tiny little, it was smaller than this room. It was a tiny little gift shop, it was really nice. And I actually bought some earrings there, and, it was really nice. And we went to a chemist and got some lockets and some more cold and flu tablets, etc. And then we were like, right, what will we do now? Neither of us were hungry. We were just like, this is going to be the longest 2 hours ever. So we headed back towards where the vets was, and we went and sat and had a coffee. And if you watched me on Instagram, you'll have seen, or Facebook stories, that I videoed the last gift shop we were in, because it had a little Rupert the Bear and little mini cars, and it was really interesting. And I bought some. Kev and I had a good laugh, I have to say. It was nice to have 2 hours together, because we don't often get that, because we don't leave Watson. And we were having a good giggle, and he was calling it frippery. He says everything you buy is frippery, like it's not anything you need. Because I bought a plaque about a dog, and I also bought a little notepad, things that, he's right, they're frippery. So we had a laugh about that, and then we went back, and we got back there about 20 past 12, and we sort of sat in the car for 5 minutes, and we were like, right, let's go in. In fact, it might have been earlier than that. So we went in and was sitting waiting anxiously, and John called us in. And I noticed he did this with the people that went in before us, and I was really impressed with this. He opens the door, and as you go in, he said, Bailey's fine, to the people before us. And as we went in, he went, Watson's fine. It's almost like he knows that the number one question in your mind is he okay? And, you want the information as soon as possible. So he literally says it before you've even sat down. Watson's fine, Bailey's fine, which is really nice and really reassuring. So he then got his whiteboard out again, because he has a whiteboard on the wall that he, draws. He was telling us about the dyskinesis, and he was talking about the dyskinesis again, saying definitely dyskinesis. And he said, as for the limp, he said his x-rays are perfect. And he showed us the x-rays. We went over to have a look. He showed us the x-rays of his hip, of his back, of his knees, of his ankles. And he said, they're not just good for a dog of this age, because bear in mind, Watson is nearly 6 and does 3 to 4 hours walking per day. He said they're perfect. And he said, so there's no signs of arthritis, nothing. That is so encouraging, although it's frustrating regarding the limp, but it's so encouraging to me, because I do worry that he's having too much walking. And when I say to some people that it's actually between 3 and 5 hours, because it just depends. Monday to Friday, except for Wednesday. 4 days he has this 3 to 5 hour walks. And I always worried that it was too much. But when people say to me it's too much, I do point out that Watson's not somebody that runs around. He's not running around for that length of time. He dawdles, he's just bimbling along or watching the other dogs and things like that, so it's really 3 to 4 hours outside he's getting, not like a really fast walker. And he doesn't really run, like I said. Occasionally he'll have a little play with the other dogs or a little run around, but usually there's some kind of ailment he's dealing with that means he doesn't want to play. And if he does play with another dog, he's got a few friends there that he plays with. He's normally really exhausted. But if he doesn't play, he's not even that tired at the end of the day, But just to see the x-rays and know that there was no arthritis has just been, I was just like, this is amazing. I was like, oh my God, I could nearly cry, I was like, this is just absolutely brilliant. So he said, as for the limp, he said, I cannot find a cause. And he said, because he's watched the video, he said, it's clearly back left, but everything is perfect on the back left. He said, he's got great muscle tone, blah, blah, blah. We've been taking him swimming and whatnot. And he said, so all we can put it down to is that it's been a coincidence that these limps happen on the left back side, and it's just been a muscle strain. So going forward, he said, to keep an eye on it, of course. And he said, and if it happens again, video it. like if it happens again, the severe limp that he had that caused us to go, because like I said, he's had these occasional limps over a couple of years now, but they go within a minute. Like he'll start limping, hold his leg up, and then 2 minutes later he'll bomb off as if nothing's wrong. It's really weird. But this more recent one that made us go to this appointment was he was lame for a week. So he said, if it happens again where he is completely lame and it doesn't go away, he said, video it and send it to me and we'll take it from there, basically. He said, but there's certainly nothing to worry about. So we were delighted, like so delighted. He was so good. He addressed everything. Like I had said at the beginning, I thought it was a cruciate ligament. And, you know, he made sure he explained why it wasn't. And I didn't have to ask him that. I didn't leave with any questions, you know. I was just like, he's so good. So he then says, right, you go out to the front desk and the nurses will bring your dog out. And it's, like I said, it's so slick. You go out to the front desk and pay. We paid, I think it was just under £800. So that was for the consultation, the sedation, and all of those x-rays. And so you pay before you get your dog back, you know, otherwise I don't know what would happen if you didn't have the money. So we paid that and they brought Watson out. And of course, he was very sleepy and very disoriented. And they said not to feed him for a couple of hours because, you know, he'd still be feeling a bit sick. And yeah, he wasn't himself. Like he wasn't responding to his name. He did come out with his tail wagging and said hello to both of us. But like if you were talking to him in the car, normally his eyebrows would move or he'd look at you, and he wasn't. He was just sort of lying there. It was horrible to see him like that. And then his tummy, his colitis was really bad because the sedation, we knew that would affect him. It always does. By the following day, his energy was back to normal. So it was just, he spent the rest of that day sleeping pretty much. He had a few tiny little walks and was just like, no, I want to go home and sleep. So that was fine. But the following day, he was back to his usual self, other than his colitis, which took about 5 days for us to mend. And I found a really good thing, and it is flaxseed oil capsules. They really helped it. It really helped get him back on track. So that's where we're at with his joints. I don't know what causes the limping. I've got to keep an eye on it, but I feel so much better now knowing he's not in pain, not with his joints anyway, you know. The other areas of health, as you'll know, are his allergies and his colitis. Or not just colitis, he's had an ongoing problem with sickness. Sickness, being fussy with food, combined with an upset bum. And it's been bad since his hospital visit before Christmas. But again, it's been so intermittent that when we go to the vets and discuss it with her, she's like, they want to do an endoscopy, but they want to do it when he's having a flare up. And it's just so up and down that we never catch him at the right time, if that makes sense. It's complex to explain, but like I said, we've got his digestion sorted out in terms of his poop. He's absolutely fine. And he has this occasional sickness that suddenly started getting a little bit worse. He was sick like 3 times in 1 week. So we went in to see the vet, but by the time we went in to see the vet, because we had the appointment in East Neuk, he hadn't been sick for a week, so there was no need to do anything. We do have some digestion tablets to give him that also seem to help. So again, we're keeping an eye on that. This is now a week and 2 days since he's been sick or even been eating grass, which is what he does when he feels sick. So yeah, hopefully that's okay, because we've got a friend who had a doodle called Rory who had also had mast cell tumours. And what can happen with mast cell tumours is they can be on the skin and then they can come back inside. And that's what happened with Rory, unfortunately. And it just broke my heart. I was really upset for the family, because they said they were gutted to see that it was back, because we'd gone through the journey together. Rory was the same age as Watson. They were both 5. Rory had been more unlucky because he'd had more than one mast cell tumour at the beginning. So he'd had all this surgery to take it off, but he'd been 3 years cancer free. But he'd started being sick and being fussy with his food. So of course I was terrified that when we went to see the specialist, they were going to find tumours. It's still something that was in my mind, but now he's not been sick for a week and a bit. I'm starting to calm down about that and think it's not that, you know. There's just no way of knowing. It's one of those things that it can happen within a week, you know, that tumours are inside. And that's my biggest worry at the moment. But like I said, a week and 2 days, he's been eating his food absolutely fine. He's not thrown up. He's not felt sick. His digestion is now fine. So hopefully that's us on top of that, and there's no more worries with that, you know. So that's that side of things. And finally, the allergies. The allergies, this is the thing we need to get on top of now, because his ears have been horrendous. I was blaming myself, thinking that I've not been doing the regime properly, because I have a regime of, I use Otidine ear cleaner. This is what the vets told me to do, a vet that I really trusted, but then he left. To use that one day, put it in, rub it in, clean them, and then the other day to use Resicort, which is a steroid anti-inflammatory drops in his ears. I'd been doing all that and I felt like it was working, but then all of a sudden I could see that they were really inflamed. The specialist that we went to see about the joints mentioned that his ears were very inflamed. And so I thought he had an infection. In fact, I looked under my microscope as well and decided he had an infection, and I used the other drops I've got, which are for infected ears. So I used those for about 4 to 5 days. I had already spoken to my local vet in this time, and I had an appointment to see her Friday just gone for him to have his Cytopoint injection. So we were to discuss it then, and she was going to have a look. She had a look, and it's funny because I said to her, his right ear is really sensitive, and she said, well, actually that's the cleanest one. But then she took some samples and later on phoned me and said, yeah, the right ear is still infected. She said, you've got rid of the infection in the vertical part of the ear, but not in the horizontal, because dogs' ears go like this. So I've now got a regime, which is the Suralan every day, twice a day in the right ear, but in the left ear, 1 day Otidine and the other day Resicort. So it's a complicated regime, but I'm hoping then that by this Friday, the end of this week, he will be in full good health, and that will be him the healthiest he's been in the 5 years we've had him. You know, that'll be us finally on top of everything. But what we've needed to do because of his ears is we also have another drug regime, which is he gets something called fungiconazole, which is an anti-yeast tablet on a weekend schedule. He's been on that for a while though, but we've now added in a bit more Apoquel. We were very reticent to do so, but when he was on Apoquel, he didn't have any problems with his ears. Well, no, that's not true. He did have problems with his ears, but they didn't get infected quite as much and they weren't quite as bad. So he's getting a week of Apoquel before his Cytopoint injection, but we decided to do half the dose she recommended, and she was okay with that. She was like, yeah, if that makes you feel better, do that and see what happens. Because he's also started bothering, he's got a little lump on his paw, which we know is just a benign cyst, but he's now bothering that as well. So yeah, that's where I'm at. I know, again, this was a long video, but I was just to give you a full update. So I'm really hopeful that with this new kind of drug and an ear regime that we can really get on top of his ears. I've realised some things I was doing wrong with my routine with his ears, which was I wasn't massaging it as much as I should. And I need to get him to shake his head before cleaning it and then clean it immediately. Whereas I was sort of leaving it for a while and then it was too dry. And I think that was why it was maybe a little bit sensitive and not as easy to clean. So yeah, I feel really, really positive about Watson's future now. And it's a lot for me to say that, you know, there is still the mast cell tumour thing is always like a horrible feeling in my stomach, you know, but I think anybody would worry about that. And especially now that, I don't think I told you, but Rory, the dog I was talking about that was sick, and they scanned him and found that he had tumours all inside, and unfortunately he was put to sleep, and the owners are devastated. And that really hit home with me, you know, because like I said, they were the same age, they'd had the same conditions, and it just shows me that it can come back at any time. And there was videos of the dog, you know, a few days before bouncing around on the beach, although he'd still been off his food and being sick. You know what dogs are like, they can sometimes seem extremely well and they're not. So I do worry about that, I'm not going to lie. I do look at him and think, oh God, you know, are you sure you're okay? Last night he was very, very restless in the night, and he was licking his lips a lot, and I was like, are you feeling sick? You know, why are you restless? Why are you not just sleeping through as you do sometimes? So I think that'll always be a worry. But all I can do is make sure I stick to the 3-month checks at the cancer centre, tell them all the symptoms, you know, and hope that makes things better. You know, hope that catches it if at all possible, you know, and just be as vigilant as ever. So that's everything. Thank you so much for watching, and I will speak to you soon.